As a medical student in India, we are taught about history taking since the second year of our MBBS degree when we attend clinical postings, and our professors have never failed to mention the importance of taking a good history as that helps us in arriving at early diagnosis of a disease. So let me tell you how we go about it. History taking refers to a set of questions that is asked to a patient in a chronological way that helps doctors arrive at a probable diagnosis of the disease the patient is suffering from. It is the first thing that is done when we meet a patient. We first ask the patients about their particulars, which includes their name, age, sex, occupation, residence. This helps us in getting familiarized to the patient. We then ask them about their chief complaints, as in what brings them to the hospital. It is written in the patient's own words. Examples of some chief complaints include cough, breathlessness, swelling, pain, and all these symptoms help us understand which system is actually affected, whether it is the respiratory system or the abdominal cavity. We then mention about the history of presenting illness, which is similar to chief complaints, just that it's written in medical terms, and it has answers to several questions like duration, mode of onset, nature, if there is any aggravating or relieving factor, etc. We also elicit various other histories like past history, in which we ask the patient if they had any similar complaints in the past. Then we ask them about the history of medications, if they are taking any medicine regarding some other associated diseases like hypertension, diabetes, mellitus. We ask them about the personal history, in which we get to know about their daily habits, whether they lead a sedentary life or and we ask them about their dietary habits, if they are vegetarians or non-vegetarians, or they have a mixed diet, if they smoke, if they drink. And we also ask about their family history, which helps us understand if they have any genetic disease, and various other histories as well. After history taking, we go about doing the general examination of the patient, which includes assessing the state of consciousness of the patient, assessing if they are febrile or afebrile, assessing for various things like lymphadenopathy, clubbing, pallor, jaundice, cyanosis, etc. Check for the vital signs of the patients, which include pulse, BP, respiratory rate, temperature. And finally, we do the particular examination of the system which we feel is most likely affected before arriving at a probable diagnosis of the disease. So yeah, this is pretty much how we go about taking the case history of a patient. It is very important to take a good history, as if we fail to ask the right questions, we fail to arrive at the right diagnosis. There are several problems that we face while taking case history of patients. Most of the time, patients fail to describe their chief complaints. It is at this point when a good clinician can help them understand and elicit the right responses. Also end up meeting some uncooperative patients who give us the wrong history of their case and mislead us with symptoms which is not relevant for their disease, just for some sympathy or attention. Sometimes language can also become an issue, especially for people like me who study or work in a different state. Patients generally prefer to converse in their native language. So yeah, I hope that I've been able to throw some light on the importance of taking a good history. Thank you.